You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, Mommy Makeovers. Hot topic. With us, we have a board-certified plastic surgeon, Dr. Lily Lee. Dr. Lee, welcome to the program.
Pleasure to be here, Randy.
Now, before we get into today's topic, for people that don't know you, I guess you have practice in Palm Desert and
That's
practice also in LA. But who's your typical patient, and what are the different procedures that you do?
You know, I don't know that I have a typical patient or procedure. I tend to serve a very broad, wide variety of people, both male, female, and of all ages. They range from late teens all the way to 97 years old.
All right. Now, you do a lot of eyes.
I do.
Said. I mean, like 10 or 15?
I do. My husband, I'm lucky enough to be married to an ophthalmologist who specializes in retina, and we tend to, I get a lot of referrals from his practice. And it's been just wonderful.
I mean, you are one of the busiest plastic surgeons for eyes. Aren't you?
I think so.
I
do
like
10 to 15. I probably do more in a week than most people do in several months.
Okay, good. So what are some of the most popular procedures that you do?
So the most popular procedure, a lot of people come through the door for the eyes, but with the eyes, a lot of times you have to address the eyebrows. You have to address the lower eyelids, and through the lower eyelids, you can end up doing a facelift. Once you rejuvenate the eyes and make the eyes look bigger and brighter, most people want to address the jawline and their face as well as their cheeks. Sometimes as we age, our nose and our ears get bigger.
So statistically, is liposuction the most popular procedure? Is that true anymore?
Liposuction is very popular because it's a great procedure and it always works.
Okay.
There's a ton of non-invasive procedures now that may or may not work, and they often have the high price tags and a lot of suffering that go along with it. With liposuction, it always works. It just doesn't not work.
Like death, taxes, and liposuction, right? The three guarantees in life.
You will have fat gone. But with the liposuction, I believe that it's actually best as an adjunct to other procedures. So chin lipo or neck lipo is great with a facelift. Lipo-abdominoplasty is great together. But straight liposuction by itself, especially in large volumes, is not something that I generally recommend.
Now, I know your age, and you look about at least 15 years younger than your age. So you actually walk your talk, I guess, skincare, things like that.
I tell everybody I know this was bought with a price, so I'm not afraid to say that I'm almost 40. Okay,
good. So let's talk a little bit about your background and training. I mean, when did you know you wanted to be a plastic surgeon?
It was pretty late. I fought my parents, being in a second-generation Asian home. They had encouraged me to be a doctor my whole life. I specifically tried to fight it. I wanted to be actually an archaeologist. The English Patient back then was a really hot movie, and I did spend some time in the Middle East doing a lot of fossil digging. And it turned out that I ended up working in a lab where we looked at DNA samples and working in a tomb. With that, I was connected with a bunch of scientists, and they said, if you're so interested in this, you really should go into medicine. And so that I did. I thought I was going to be a pediatrician to start. It turned out I really wanted something a little bit more visual, a lot more hands-on, more doing kind of thing. And so I went into surgery. I started wanting to be a trauma surgeon, which led me to Los Angeles because I wanted to work at the trauma center in LA. And that, once I got into that, then it turned out that I wanted to be something a little bit more artistic and visual.
Okay, you went to USC, is that right?
I did. I went to USC. I did my training at USC.
Okay.
Prior to that, I went to medical school at a school called Case Western Reserve. It's in Cleveland, Ohio. We rotated at the Cleveland Clinic, which is a wonderful, one of the finest institutions in the United States. And then I was tired of the cold, rainy, icy weather. And
so moving on to today's topic, Mommy Makeover. Give us a working definition. What is it?
So Mommy Makeover, I think, is different from traditional, which is just a tummy tuck and a breast, either lift or augmentation. I think it's really just a rejuvenation of what a mommy was in her dating years, in her teens or 20s, or even what she hoped and wanted to be.
So on a consult, do they call it a Mommy Makeover, by the way?
Some do.
And what do they ask? I mean, what do they want to know?
So it's actually on my form, on the intake form. And so sometimes if they come in for something different, it gets them thinking about Mommy Makeover. And so I think a lot of times they do think tummy tuck right away.
Okay.
Because that is the most dramatic thing that changes during pregnancy and childbearing ages. And I think that a lot of times when people come in for other things, they're not really thinking about it. I'm a mother. I realize that after kids, it's all about the kids. You know, you plan a weekend at the beach or you go to Hawaii and your kid's trunk is full of all kinds of stuff, and you show up with, you know, a bathing suit cover-up and a pair of jeans. And so everything's about the kids. You start to feel invisible. You are just the puppeteer behind your kids, the websites that you surf, the magazines that you read, the books that you read, the television channels that you surf, that you're looking at. It's all about the kids, and you start to forget about yourself, and you start to forget about investing in yourself and what it feels like to be paid attention to, the kind of attention that you got when you were dating and when you were out single.
So when should somebody do something about it?
It's a very personal choice, but a lot of it depends on when they start to get bothered. And a lot of times I'm not sure they know. It's when they start making lifestyle changes, when they start not showing up, when they start buying the one piece as opposed to the two piece, when they start keeping the cover up on at the beach the entire day, when they start not going out as much because they just don't feel like there's a dress that will make them feel great.
Okay.
It's really when they start making lifestyle changes. And a lot of times this is very subtle, and it takes a really good friend or their husband to
Do they come in together? Do you encourage they come in with their spouse?
I do.
Or their partner? Do you encourage that?
I do. I very much encourage them. A lot of times they'll come by themselves for the first time, but I usually encourage them to bring at least a friend or a partner or a spouse in, because that person is going to be a very huge supportive role throughout this process.
Is there like a trigger? Like when they come in on the consult, do they tell you, I've had enough? I mean, what gets them to do it? What do you
Absolutely. You can look at my schedule and you'll know I'm very busy in the spring. Graduations, Easter are big, or summer trips are really big. Come September, much more quiet. Everyone's focused on getting kids back into school.
All right, so you like low incisions, you
Absolutely. That is the name of the game. Low, low, low. I want them to be able to wear what they want. I want them to enjoy their clothes. I want them to go into the store and say, I can wear that.
So in the procedure then, so you're addressing the skin, like stretch marks, wrinkles, whatever.
Yes.
And then you're addressing the muscles.
That's right.
You said that, because we talked on the phone, right? And you said that you felt that you do a better tummy tuck maybe than most. I don't want to put words in your mouth, but you said...
It takes longer around it. It's much more time-consuming. It's a lot of effort, but I think it's so worth it in the end. We plicate in every direction. Not only do I fold it this direction, I fold it this direction, because when you think about the abdominal girth, it just goes out like a balloon, and so it does need to be tightened, not only in the vertical direction, but also in the horizontal direction sometimes.
So, so the typical tummy tuck, you're saying, is only, what, done one way? Like the way you were taught in medical school, are you doing it that way?
Not anymore.
Okay.
I mean, I'm doing that and more. I think the way we were taught was just to right down the center, probably a couple centimeters.
And pull it together.
Pull it together, one layer. I do button and zipper. I tell everybody. I zip it up and then I take buttons so that it doesn't. I've seen too many people come in and say, I had a tummy tuck, it worked great for about 6 weeks, and then I coughed and it all came back out again.
Is that right?
And that's a disaster.
And that can happen.
Unfortunately.
So you say, so when you're telling me on the telephone that you do a lot of muscle work,
correct,
it may take you another half hour longer than most
sure
plastic surgeons?
Sure.
Okay.
Sure.
Do women like going to you, by the way? I mean, it seems like a woman would prefer a female plastic surgeon.
I think so. And I think not only just a female, but I am a mom. So I understand. I understand how it feels to be totally engrossed in a baby and then children, forget about yourself, that invisible feeling. My husband actually one time for Christmas said, I'm going to get you a shopping spree for Christmas. And I said, why? And he said, don't take this the wrong way, but you know, since the kids, you've really gotten pre-frumpy. Not quite there, but you're almost there.
Wow, that's a brave man to say something like that.
But I think it's what it takes. It takes somebody close to you to say, you know, you're making those lifestyle changes that you didn't make before. And I think it's because you're not feeling so good about yourself.
So this is a boost in self-esteem.
100%.
Like what changes do you see? Because we've talked, and you say that you're changing people's lives. Elaborate on that.
We have a joke in plastic surgery that the pre and the post-op photos need to be exactly the same. And it's not so much with the body, but with the face, a lot of times we get criticized when the post-op photo has a lot of makeup on. And sometimes you just can't control them. You can't control these people. They feel better about themselves. And so they start investing more into it. They start putting on more makeup. They wear tighter clothes. They wear more revealing clothes. They choose clothes that they could never choose before. And so a lot of times it affects our pre and post-op photos in that you just can't, we get accused for trying to make the post-op look better, but it's really because the patient feels better about themselves.
So you're giving them a younger body with a mommy makeover.
Yes.
Is that right?
That's right.
Now, as far as the tummy tuck, and I feel, because I've had plastic surgeons on my show before, and I've seen before and afters, and because of that, I feel like I could spot a tummy tuck 20 yards away. The belly button seems to be a dead giveaway.
Unfortunately, I'm very proud of my belly buttons.
Okay.
And similarly, the belly buttons, I think, if you take the time to do it right, that scar should be virtually invisible. It should be so deep in there. If you pull the belly button tight, if you placate the belly button down so that it's an innie, it's not an outie. That sunburst pattern is awful.
Because
you're right.
It can look flat and stretched.
It can look flat, stretched. The scar can be huge and widened. So if it's done on too much tension, it can stretch and not keloid, but hypertrophy, and that looks...
So when it's all done and they're healed up, how soon can they go, like, to the beach and show off their flat stomach?
In a healthy person, about 2 weeks. I had a lady who had her 20-year high school reunion coming up, and she waited a little bit too long to come, or she thought, to me. And originally we were talking about doing her mommy makeover after her reunion, but she said, if there's any way, and it was in 4 weeks. And I said, we can do it. I know we can.
All right.
And sure enough, she went in a nice fitted dress, and she felt great about it.
Now they're beach ready, so in less than a month. What about up and around?
Up and around, it depends on the muscle work, but I think with the average amount of muscle work, which I do a lot of, they're still up and about in 2 weeks. They are a little bit more sore because I do so much plicating, and I don't want them to just really go for it, stretch. But a lot of these women are very active. They've got kids to take care of. They've got their yoga to keep up with. So they're back at it in about 2 weeks.
Do you find that when it's all done, people start taking better care of themselves because they've made this investment? Like eating better, things like that?
They eat better, they're juicing, they're working out, they're just getting out more. They have more goals, they have more events that they need to get to because they're not afraid anymore.
Okay, now on the consult, what are their fears? Like, what do they ask you every time about the tummy tuck?
So they're worried about the scars.
Okay.
The belly button is a big one, or the high scar. Or they've probably been to Hawaii and, I saw somebody and it was clear that they had a tummy tuck because I saw the scar poking out. They're worried about the recovery. People are wondering whether or not they're going to be hunched over in pain. They're concerned about the amount of pain that's after surgery. And they're concerned about just getting on with life. Are they going to be walking around a little bit hunched over, or are they going to be able to stand up straight? Are they going to be able to carry groceries and kids? And
so at what point are you not a candidate for liposuction and you're a candidate for a tummy tuck?
I think anytime there's a lot of skin.
Okay.
And I think that's actually most people. With liposuction, if you just liposuck, you really have to have pretty tight skin. But I think most people who've had at least one child have enough skin that would require a tummy tuck.
Is there a lot of lipo going on where it should be a tummy tuck?
Unfortunately, and you see a lot of that loose excess skin.
Okay.
There's some non-invasive technologies now, same. I do believe in lipo. I think lipo, it always works. It works great. But it can leave some slight lumps, and it doesn't do anything to excess skin.
Okay. Now, because you do extra muscle work when it comes to the tummy tuck, are they able to are you able to like thin out the waist? It's not just flat?
So that has to be done with liposuction.
Okay, do you do that in combination?
Absolutely. And sometimes it has to be staged. And sometimes it's a separate procedure, but a much easier procedure. Because of the blood supply, it needs to be separated out.
Okay, good. So moving on up. Okay, so breast lifting, breast augmentation. Are you always doing augmentation with a lift? Tell me about
There's no one size fits all.
Okay.
Everybody's different. Sometimes they require just a lift. If they're happy with their size, a lift is fine. If they're not happy with their size and they don't have any droop, a lot of my women are very small to begin with, and they've just always wanted, or they wanted the breasts that they had when they were pregnant or breastfeeding. They never knew they could look so hot and voluptuous, and they want that back. And so an augmentation oftentimes will suffice.
So do you do the procedures together? That means if you're going to do the tummy tuck, you're also doing the breast surgery?
They can.
Usually on the same day? They
can be done together, and they can be outpatient surgery, depending on kind of the amount and the health of the person. Most of these women are very healthy. They lead active lives, and they can go to sleep one way and wake up a whole new person.
So in this economy, what do you tell a woman that's worried about that, about investing or spending money on procedures like this?
I think who better to invest in than yourself?
Okay.
I tell everybody, who better? Once you have this, you will feel better. Your work will be better. Your relationship with your husband and your kids will be better. You'll be that much more confident in yourself. Stepping out the door, you'll feel better about yourself. You'll want to do more.
Okay. Now, do you see, you yourself, you said you had your eyes,
yes.
eye surgery.
Yes.
And you said for you it changed your whole life.
Absolutely. I think it was something I was very self-conscious about. I didn't have that crease in my eyes that some Asians do and a lot of Asians don't. And I had that done fairly late. A lot of people do it, and a lot of Asians do it in their teens, but I didn't have it done until my late 20s. And for me, it really changed. It changed how I felt about myself. Before I left in the morning, it would take me a lot longer to put on makeup. I felt like I had to really camouflage what I had to make my eyes look wider. And so it changed my self-confidence, and it changed how I put on makeup and what I felt like I could do with myself.
So with a breast lift, I wanted to ask you, what about the incisions? Because isn't that one of the challenges?
So the incisions, they can be hidden. And depending on how the person scars and the amount of tension that is on and how well they're sewn together, the scars can be very minimal and fade with time. Unless absolutely necessary, I don't often do the full anchor incision so that we do not do any cutting up in the décolleté area at all.
So that T-scar is what you're talking about when you say an anchor?
Yes, that the upside down T that comes all the way around, sometimes up into the armpit area and into the cleavage. There's very few people who. So
you don't do that. I mean, you don't need to do that.
No,
most of the time?
Unfortunately, or fortunately, we don't need to do that. Most of the incisions can be hidden around the areola, and at the very most, a line coming down from like a lollipop.
Okay. In all areas of plastic surgery, is this like the Mommy Makeover? Is it one of the happiest group of patients?
This is. The satisfaction rate for this is so high. I think because sometimes they don't realize that this can be achieved and that they can go back to feeling like that very confident 20-year-old that they were before. I had a patient send me a videotape, and at first I was like, what is this? It was a bonfire, actually, and she said, these are all the push-up bras and the Spanx that I don't need anymore.
Okay, good, good. So people become more active because of this. And it's just, I guess the number one thing is it's a boost to their self-esteem.
100%.
So if you don't if a woman is watching this and she doesn't like the way her body has aged or it's not bouncing back after pregnancy, what's the first move?
They should pick up the phone, or they should get online to my website and give me a call.
All right.
Schedule themselves an appointment, come in.
Are they free? Are the consultations
all consultations are free. There is absolutely no commitment required. They come in just to hear what I have to say. Let me take a look at them, and we can customize a plan. And you can do that plan all in one, or sometimes we have to spread that plan over a year or two for the transformation that they need. But everybody's a little bit different, and everybody needs a separate customized plan to get them to their customized dream.
All right. So how important is choosing a surgeon that's board certified, in your opinion?
You know, the board certification process for plastic surgery is not an easy one. There's several hoops over several years that it takes. We have to be fully trained in an accredited facility, and then we submit all of our cases, every single one of them in chronologic order, to a big board.
Was that right?
And we all fly to one city at one time. We get grilled over these cases. And I think it shows commitment. I think it shows that someone who is so into it that they're going to jump through all these hoops for it, that they care. to do it.
Now, we're just about out of time. But what haven't we talked about when it comes to mommy makeover?
You know, we've talked about the tummy, we've talked about the breast, but I think the face is something that oftentimes gets ignored. And I think because people are youthful, they don't worry about it so much, but there can be things that we can address. Just even the fine lines and wrinkles that are beginning to appear can be really easily addressed with non-surgical or surgical things. We can do facelift, Botox, fillers. Fillers these days are wonderful. They last longer and longer. They're less and less invasive, and they can look more and more natural.
So what are the most common areas for fillers?
The most common area for fillers around the oral area.
Okay.
But it's this area that we call the laugh lines or the smile lines are very popular, but it's not my favorite place to put it. And the reason why is because I think you need to address the problem. Filling this area is really a camouflage, and it's because over time we lose volume in our cheeks, and as we lose the volume in our cheeks, this area gets deeper. And so to fill this area, you can do it for very subtle, but really what you want to do is lift the cheek and fill, re-volumize what used to be there, put back what used to be there to make this a little bit softer. Everybody has this smile line. There's a bony attachment to your skin, which is why we have this. Babies have it. To make that completely gone looks weird.
Yeah. Yeah, because we've seen, I mean, you can see when people are overfilled.
Absolutely.
Quite a bit. So you're saying it's the mid-face, right here,
I think
like
the
cheek.
mid-face is, filling up the mid-face makes them look more youthful. It gives them more of a curve from the profile. Absolutely.
What about the lips? You do lips?
I do lips. I think lips need to be very carefully and subtly done. I detest that duck look. I think that big, voluptuous lip, nobody's born with that. I mean, Angelina Jolie is lucky enough to have them really naturally beautiful, but very few people have really gigantic lips, and I think that it looks awful. I think if you can't purse your lips when you're talking,
I'm glad to hear you say that.
It looks ridiculous.
So whose idea is it then? Is it the plastic surgeon that's doing the big lips? Is it the patient demanding they want those big lips?
Personally, as a plastic surgeon, I would never force that on anyone. I think it looks unnatural, and the last thing I want is somebody walking around out there displaying what could be perceived as my work. I think sometimes it's the goal. Maybe they're trying to get rid of the fine lines and they're overfilling because that's the only way they know how to get rid of it.
And we're out of time. But final message to the potential mommy makeover candidate watching this.
I say, in this world, everybody wants a piece of you. Your husband, your job, your work, your friends, your children. Who better to invest than yourself? Come in, it's commitment free. Just listen to what I have to say. Just listen to where we could improve, how I can make you feel better about yourself.
Do you ever do a consult and they're just such a good candidate that you get a little excited and you go, boy, this is going to be good?
Absolutely.
Like what goes on in your head when you see these patients? Like on the consult? I
know the progression. I know at a month they'll start to feel a little bit happier, and then it just gets better and better. And in about 6 months, then it starts to plateau a little bit. I know the psychology, and I've seen it hundreds and hundreds of times, how they start to go out and buy clothes that they, sometimes I'll get texts and, oh, I've never spent this amount of money on a dress. I didn't know that I could or I ever would. I think the most expensive thing about a mommy makeover, aside from the surgery and all the recovery, once that's all done and over, it's the clothes, it's the makeup, it's the investment that they put into themselves because they feel good about themselves and they know that they can get where they want to be. When we do a mommy makeover, it opens doors, opportunities that have never presented themselves, new relationships, new jobs, opportunity for promotion, because you're more confident about yourself.
Makes sense.
And you'll just talk about what you're not afraid to tell people what you want because you've gotten what you want.
Great info. I want to thank you for coming on the show.
Thank you, Randy. It was a pleasure.
You've been watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. If you'd like to see this interview again online, visit our website and just put in Dr. Lee. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.